Hello, this is Dr. Grande. Today's question is borderline personality disorder comorbid with other mental health disorders? So this is a good question, and a lot of times when we look at the literature in terms of treatment of borderline personality disorder, we see that among clinicians, borderline personality disorder is sometimes viewed as difficult to treat. And one of the reasons this perception exists probably has to do with the level of comorbidity. That is, the number of other illnesses that tend to co-occur with borderline personality disorder. So we can think of the mental health disorders in the DSM as being in a number of different categories, but one popular way to think of it is in two categories, which is the personality disorders and then mental health disorders that aren't personality disorders. So if we look at the comorbidity with borderline and other personality disorders, we see that it's comorbid with antisocial personality disorder, dependent personality disorder, obsessive-compulsive, paranoid, narcissistic, and histrionic personality disorders. When we look at mental health disorders that are not personality disorders, we also see a lot of comorbidity with borderline personality disorder. There was an article in 2013 by Biskin and Paris that looked at the comorbidity of borderline personality disorder with a lot of other mental health disorders. One of the areas they looked at is how many other mental health disorders would we expect to see over the lifetime with somebody that has borderline personality disorder. This is the mean number of mental health disorders. For borderline personality disorder, it's 4. So 4 mental health disorders would be the average for comorbid mental health disorders when we see borderline personality disorder. In terms of personality disorders, the mean was 2. So this means over the lifetime we would expect to see more than one personality disorder diagnosed with somebody that has borderline personality disorder. Now, in terms of the percent of people with borderline personality disorder that also have specified other mental health disorders, when we look at anxiety, about 88% of people with borderline personality disorder have anxiety. About 75% have depression. 50% of individuals with borderline personality disorder have posttraumatic stress disorder. Now, this really isn't too surprising when we look at what we believe is etiological for borderline personality disorder, meaning what we believe may cause the disorder. Trauma is one of those elements that's been identified as potentially causal for borderline personality disorder. Certainly it seems to make some sort of contribution. There's a strong association. So a high comorbidity with PTSD wouldn't be surprising. Some other disorders that are highly comorbid: panic disorder, we see that about 40% of the time. Substance use disorders, about 55 to 60% of the time. Eating disorders, we see about 15% of the time, and bulimia would be overrepresented in that group. And ADHD occurs in about 25% of the presentations of borderline personality disorder. So borderline personality disorder, as I mentioned, has high comorbidity with a number of other mental health disorders, and this may be part of the reason it's perceived sometimes as resistant to treatment. This also emphasizes the need for careful diagnosis and precise treatment planning. It's unlikely that any particular clinician would see a large number of borderline personality presentations without any comorbidity during their career. So this is a disorder where we tend to expect comorbidity based on the statistics we have available. I hope you found this description of borderline personality disorder and comorbidity to be interesting. Thanks for watching.